Describe your experience in monitoring patients immediately post-anesthesia. What are some key assessments you prioritize?
In my experience monitoring patients immediately post-anesthesia, I have developed a comprehensive approach that focuses on ensuring patient safety and promoting recovery. After anesthesia, patients are in a vulnerable state, and it is crucial to perform continuous assessments to detect any signs of complications early. One of the key assessments I prioritize is monitoring the patient's airway, breathing, and circulation, often referred to as the ABCs. Ensuring the airway remains open and unobstructed is vital, as is keeping track of respiratory rate and oxygen saturation levels using pulse oximetry. I also frequently assess the patient's level of consciousness to ensure they are gradually regaining awareness, paying close attention to their responses to verbal stimuli. Hemodynamic stability is another critical aspect, therefore, I regularly check blood pressure, heart rate, and peripheral perfusion to identify any signs of hypotension or hypertension, which could indicate underlying issues such as bleeding or adverse reactions to anesthesia. Additionally, I monitor the surgical site for any signs of excessive bleeding or discharge, as this can quickly become a serious concern if not addressed promptly. Pain management is also a significant focus. I assess the patient's pain level using appropriate scales, especially since many may not be fully awake to communicate their discomfort clearly. Ensuring adequate pain relief is crucial for their overall comfort and recovery process. Through these prioritized assessments, I ensure that any emerging complications are swiftly identified and managed, facilitating a smooth transition from anesthesia to full consciousness and stability.
How do you manage a patient who is experiencing emergence delirium or agitation in the PACU?
Managing a patient experiencing emergence delirium or agitation in the post-anesthesia care unit, PACU, requires a calm, systematic, and patient-centered approach. Emergence delirium is characterized by confusion, restlessness, and agitation as the patient emerges from anesthesia, and it can be distressing both for the patient and the healthcare team. Firstly, I ensure the safety of the patient by creating a secure environment. I remove any potentially harmful objects nearby and gently restrain the patient if necessary, using minimal force to prevent self-injury or harm to others. It is important to reassure the patient in a soothing tone, helping them to orient gradually to their surroundings. Simple explanations about where they are and what is happening can alleviate some of the confusion. Simultaneously, I assess the patient's vital signs to rule out any physiological causes that might be contributing to the delirium, such as hypoxia, hypercarbia, or hemodynamic instability. Providing supplemental oxygen if there are signs of hypoxia can be beneficial, as low oxygen levels might exacerbate agitation. Pain management is another crucial aspect. Uncontrolled pain can often contribute to agitation, so I assess the pain levels and administer appropriate analgesics as needed. If the patient's condition allows, I use non-pharmacological methods such as repositioning or applying a cold or warm compress to offer additional comfort. In cases where the delirium persists or is severe, I may administer pharmacological interventions, such as small doses of benzodiazepines or antipsychotics, under the direction of the anesthesiologist or physician. However, I always weigh the risks and benefits of such interventions, ensuring they are necessary and appropriate for the patient's condition. Throughout this process, I communicate with the rest of the healthcare team, keeping them updated on the patient's status and any interventions used. This multidisciplinary approach ensures that we can quickly adapt to any changes in the patient's condition and provide comprehensive care. Overall, my focus remains on creating a calm, supportive environment, addressing underlying causes, and using both non-pharmacological and pharmacological strategies as needed to manage emergence delirium effectively.
Explain your understanding of different anesthetic agents and their potential side effects in the recovery phase.
Anesthetic agents play a crucial role in providing pain relief and unconsciousness during surgical procedures, and each has unique characteristics that can influence the recovery phase. My understanding of these agents includes both their intended effects and potential side effects, which are critical to monitor in the post-anesthesia care unit, PACU. Inhalational agents. Common inhalational anesthetics, such as sevoflurane, isoflurane, and desflurane, are used to maintain anesthesia during surgery. These agents can cause side effects such as nausea and vomiting, which are common in the recovery phase. They can also lead to respiratory depression, hypotension, and in rare cases, malignant hyperthermia, a life-threatening condition that requires immediate intervention. Intravenous agents. Propofol, often used for induction and maintenance of anesthesia, has a rapid onset and quick recovery profile. However, it can cause hypotension, bradycardia, and respiratory depression. Additionally, some patients may experience pain at the injection site and, less commonly, an allergic reaction. Opioids. Opioids like fentanyl and morphine are frequently used for pain control during and after surgery. While effective, they can lead to side effects such as respiratory depression, constipation, nausea, vomiting, and itching. In the recovery phase, managing these side effects is essential to ensure the patient's comfort and safety. Neuromuscular blocking agents. These agents, such as rocuronium and succinylcholine, are used to facilitate intubation and muscle relaxation during surgery. In the recovery phase, inadequate reversal of these agents can lead to residual muscle weakness or even respiratory compromise, necessitating close monitoring and appropriate use of reversal agents like neostigmine or sugammadex. Local anesthetics. Agents like lidocaine and bupivacaine are used for regional blocks or local infiltration. Potential side effects include systemic toxicity if absorbed in high doses, which can manifest as CNS disturbances such as dizziness, tinnitus, seizures, or cardiovascular issues like arrhythmias and hypotension. Understanding these different anesthetic agents and their potential side effects enables me to provide vigilant care in the recovery phase. By closely monitoring patients and managing any side effects promptly, I can help ensure a smoother transition from anesthesia to full consciousness, promoting a safer and more comfortable recovery.
A patient in your care develops respiratory depression in the PACU. Describe your immediate actions and management plan.
When a patient develops respiratory depression in the post-anesthesia care unit, PACU, immediate action is critical to prevent severe complications. My response involves a structured approach to assess and manage the situation effectively. Firstly, I ensure the patient's airway is open and assess their breathing and oxygenation status. I check for signs such as a decreased respiratory rate, shallow breaths, and low oxygen saturation levels using a pulse oximeter. If oxygen saturation is below normal, I provide supplemental oxygen through a nasal cannula or mask, depending on the severity of the depression. Next, I perform a quick assessment to determine the underlying cause. Common causes in the PACU include residual effects of anesthetic agents, opioids, or sedatives. I review the patient's medication history, including any recent administration of these agents, to identify potential contributors. If opioid-induced respiratory depression is suspected, I prepare to administer naloxone, an opioid antagonist, in titrated doses to reverse the effects. This is done carefully to avoid sudden pain or withdrawal symptoms. If sedatives are the cause, I consider using flumazenil, a benzodiazepine antagonist, following similar careful titration. While addressing the immediate respiratory needs, I continuously monitor the patient's vital signs, including heart rate, blood pressure, and respiratory rate, to detect any changes or improvements. I ensure that airway equipment, such as a bag valve mask and intubation supplies, are readily available should the patient require advanced airway management. I also collaborate with the anesthesiologist and the rest of the healthcare team to implement a comprehensive plan, which may involve adjusting the patient's pain management regimen to reduce the risk of further respiratory depression without compromising pain control. Throughout this process, I provide reassurance to the patient and document all interventions and their outcomes in the patient's records to maintain clear communication and continuity of care. In summary, my immediate actions for a patient with respiratory depression in the PACU include securing the airway, providing supplemental oxygen, identifying the cause, administering appropriate antagonists if needed, and continuous monitoring, all while ensuring readiness for advanced airway management if necessary.
How do you ensure patient comfort and safety during the recovery period?
Ensuring patient comfort and safety during the recovery period is a multifaceted approach that involves continuous monitoring, effective pain management, and attentive care to address both physical and emotional needs. Monitoring vital signs. Constant monitoring of vital signs, including heart rate, blood pressure, respiratory rate, and oxygen saturation, is fundamental. This helps detect any early signs of complications such as respiratory depression, hypotension, or arrhythmias. Ensuring hemodynamic stability is crucial for both comfort and safety. Pain management. Effective pain management is paramount. I regularly assess the patient's pain using validated scales, such as the Numeric Rating Scale, NRS, or the Visual Analog Scale, VAS, and provide timely analgesics based on the patient's needs and the prescribed regimen. Balancing pain relief while minimizing side effects like nausea or sedation is key. For patients who cannot communicate well, I observe nonverbal cues like facial expressions, restlessness, or moaning to assess pain. Positioning and repositioning. Proper positioning of the patient is important to enhance comfort and prevent complications such as pressure ulcers, aspiration, or respiratory distress. I ensure the patient is positioned comfortably, often semi-upright, to promote optimal breathing. Repositioning regularly also helps prevent discomfort and complications associated with immobility. Addressing nausea and vomiting. Postoperative nausea and vomiting, PONV, are common issues that can significantly impact patient comfort. I administer antiemetics as prescribed and offer sips of water or ice chips when appropriate to soothe the patient's throat and stomach. Emotional support and reassurance. The recovery period can be anxiety-inducing for many patients. I provide emotional support by offering reassurance, explaining the recovery process, and answering any questions they might have. This helps reduce anxiety and fosters a sense of security. Preventing hypothermia. Maintaining a warm environment or using warming blankets is essential to prevent hypothermia, which can cause discomfort and complicate recovery. I frequently check the patient's temperature and adjust their coverings accordingly. Hydration and nutrition. Once the patient is awake and has no contraindications, I gradually introduce fluids and, when appropriate, light meals to ensure they remain hydrated and nourished, which aids recovery and overall well-being. Documentation and communication. I meticulously document all care provided and any changes in the patient's condition. Effective communication with the healthcare team ensures that everyone is aware of the patient's needs and the care plan, contributing to a coordinated and safe recovery process. Through these comprehensive measures, I ensure that the patient's comfort and safety are prioritized, paving the way for a smooth recovery period.
Describe your approach to communicating with patients who are still recovering from anesthesia and may be disoriented or in pain.
Communicating with patients recovering from anesthesia, who may be disoriented or in pain, requires a gentle, patient-centered approach that prioritizes clarity, empathy, and reassurance. Establishing a calm environment. I begin by ensuring a quiet and calm environment to reduce sensory overload, which can exacerbate disorientation. I speak in a soft, soothing tone to help the patient feel at ease and prevent additional anxiety. Simple and clear language. I use simple, clear language and avoid medical jargon. For instance, instead of saying, "You are in the PACU post-op," I would say, you are in the recovery room after your surgery. This helps the patient better understand their surroundings and situation, even in a state of confusion. Reassurance and orientation. I frequently reassure the patient that they are safe and that their surgery is over. Reorienting them by reminding them of the time, place, and what has occurred is helpful. For example, I might say, "You had your procedure, and everything went well. You're in the recovery room now, and we're here to take care of you." Active listening and nonverbal cues. I pay close attention to both verbal responses and nonverbal cues, such as facial expressions or body language, which may indicate pain or discomfort. Since some patients may not be able to articulate their feelings clearly, I observe these cues to assess their needs. Short, open-ended questions. To gauge their level of orientation and comfort, I ask short, open-ended questions like, "Are you feeling any pain?" or "Can you tell me how you feel right now?" This encourages the patient to communicate their current state without overwhelming them with complex questions. Reinforcing trust. I consistently remind the patient that they can trust the care team. Statements like, "We're monitoring everything to ensure you're comfortable," help build a sense of trust and security during a vulnerable time. Providing pain relief information. If the patient is in pain, I reassure them that pain management is a priority. I might say, "If you're in pain, let me know so we can give you something to feel better," and promptly address their pain concerns. Involving family members. When appropriate, I involve family members to provide familiar comfort, which can help reduce disorientation and anxiety, particularly in patients who may be more susceptible to confusion. By combining these strategies, I ensure effective communication that respects the patient's condition, promotes comfort, and facilitates a smoother recovery experience.
How do you prioritize patient care when managing multiple patients in the PACU, each with varying needs?
Prioritizing patient care in the post-anesthesia care unit, PACU, when managing multiple patients with varying needs involves a systematic approach that balances critical assessments, timely interventions, and effective time management. My approach is guided by the principles of triage, continuous monitoring, and clear communication. Initial assessment and triage. Upon receiving patients in the PACU, I conduct a quick but thorough initial assessment to identify those with immediate, life-threatening needs. Patients with compromised airways, severe pain, significant hemodynamic instability, or signs of respiratory depression are prioritized for immediate intervention. This triage process ensures that critical care is delivered swiftly to those who need it most. Ongoing monitoring and reassessment. I continuously monitor all patients using vital signs, oxygen saturation, and pain levels, adjusting my priorities based on changes in their condition. Regular reassessments help detect any emerging issues early, allowing for timely responses. For example, if a patient who was initially stable starts showing signs of respiratory distress, I shift my focus to address this urgent need. Effective pain management. Pain management is a key component of PACU care. I prioritize patients in severe pain by administering analgesics as needed and evaluating the effectiveness of the intervention. Managing pain not only improves patient comfort but also helps in their overall recovery process, allowing me to better allocate my time to other patients once their pain is controlled. Delegation and collaboration. Working collaboratively with the PACU team is essential. I delegate tasks to other nurses or healthcare assistants when appropriate, ensuring that routine tasks like vital sign monitoring or administering medications are managed efficiently. Clear communication with the team ensures that everyone is aware of patient priorities and care plans. Time management and documentation. Efficient time management allows me to balance the needs of multiple patients. I create a mental checklist of tasks and prioritize based on urgency. Simultaneously, I maintain accurate and timely documentation, which supports seamless care transitions and helps me keep track of each patient's progress and interventions. Patient and family communication. I keep patients and their families informed about the care plan and any changes in their condition. This open communication helps manage expectations and reduces anxiety, enabling smoother care coordination. By combining these strategies, I ensure that each patient receives the necessary care promptly and safely, even in a high-pressure environment like the PACU. Prioritizing based on acuity, continuous reassessment, teamwork, and effective communication allows me to manage multiple patients efficiently while maintaining high standards of care.
Describe your experience working collaboratively with anesthesiologists, surgeons, and other healthcare professionals in the postoperative setting.
My experience working collaboratively with anesthesiologists, surgeons, and other healthcare professionals in the postoperative setting has been integral to providing comprehensive and effective patient care. In the PACU, teamwork is essential, as the recovery phase requires close coordination between various specialties to ensure patient safety and a smooth transition from surgery to recovery. Close collaboration with anesthesiologists. I work closely with anesthesiologists to monitor patients emerging from anesthesia. Anesthesiologists provide critical input on the patient's anesthesia history, potential complications, and pain management strategies. For example, if a patient experiences respiratory depression or inadequate pain control, I promptly inform the anesthesiologist, and we collaborate to adjust medications or interventions accordingly. This dynamic interaction ensures that patients receive personalized and responsive care. Effective communication with surgeons. Postoperative care often involves monitoring for complications related to the surgical procedure itself. I maintain open lines of communication with surgeons, updating them on any unusual findings such as excessive bleeding, signs of infection, or unexpected pain levels. Quick communication allows surgeons to provide guidance on specific postoperative instructions or make decisions on further interventions, such as imaging or additional treatments. Coordination with nurses and allied health professionals. The PACU team includes nurses, respiratory therapists, and sometimes physical therapists or pharmacists. I coordinate closely with fellow nurses to ensure that patient handoffs are thorough and that each team member is aware of the patient's condition, medications, and care plan. Respiratory therapists may assist in managing airway issues, especially in patients with pre-existing respiratory conditions, while pharmacists can offer insights into optimizing medication regimens. Interdisciplinary rounds and handoffs. Participating in interdisciplinary rounds is another vital aspect of my collaborative experience. These rounds involve discussing each patient's status, progress, and care plan with the entire team. During these interactions, I contribute observations and patient responses to treatments, while also integrating insights from other professionals to refine the care strategy. Proactive problem solving. In the postoperative setting, unforeseen challenges can arise. Collaborating with the healthcare team to develop solutions, such as adjusting pain management protocols or addressing unexpected complications, has been a regular part of my role. This collective problem-solving enhances patient outcomes and fosters a supportive team environment. Overall, my collaborative work with anesthesiologists, surgeons, and other healthcare professionals ensures that patient care in the postoperative setting is holistic, well-coordinated, and responsive to the complex needs of patients recovering from surgery.
How do you handle stressful situations or unexpected complications in the PACU?
Handling stressful situations or unexpected complications in the post-anesthesia care unit, PACU, requires a calm, methodical approach, guided by experience, training, and effective communication. The PACU environment is fast-paced, with patients emerging from anesthesia who may develop sudden complications, necessitating quick decision-making and adaptability. Staying calm and focused. My first priority in any stressful situation is to remain calm and composed. Maintaining a clear mind allows me to assess the situation accurately and make informed decisions without being overwhelmed by the pressure. I focus on the immediate needs of the patient, which helps in prioritizing actions and stabilizing the situation. Rapid assessment and intervention. When faced with unexpected complications such as respiratory depression, hypotension, or severe pain, I conduct a rapid assessment to identify the cause. I quickly evaluate vital signs, oxygenation, and the surgical site for any signs of distress or abnormality. Based on this assessment, I initiate appropriate interventions, such as administering oxygen, adjusting medications, or calling for additional assistance if needed. Effective communication. Clear and timely communication with the healthcare team is crucial. I promptly inform the anesthesiologist, surgeon, or charge nurse about the complication, providing concise updates on the patient's condition and the interventions already undertaken. This ensures that all necessary resources are mobilized quickly, and expert input is readily available. Utilizing protocols and guidelines. The PACU operates with established protocols for managing common complications like airway obstruction, postoperative nausea, and pain. I rely on these guidelines to implement evidence-based interventions swiftly. If a situation deviates from standard complications, I adapt my approach while ensuring that safety protocols are adhered to. Teamwork and support. In high-pressure situations, teamwork is invaluable. I collaborate closely with my colleagues, delegating tasks when necessary to ensure that all aspects of the patient's care are addressed simultaneously. For example, while I may manage the airway, another nurse can monitor vitals or prepare emergency medications, ensuring a coordinated response. Reflecting and learning. After managing a stressful situation or complication, I reflect on the event to understand what went well and what could be improved. This reflection helps me enhance my skills and prepare for future challenges. Additionally, I participate in debriefings with the team to discuss the incident and incorporate feedback into our practice. Self-care and stress management. Recognizing the impact of stress on personal well-being, I practice stress management techniques such as deep breathing, mindfulness, and regular breaks when possible. Maintaining physical and emotional health ensures that I can continue to provide high-quality care even in demanding situations. Through these strategies, I effectively manage stressful situations and unexpected complications in the PACU, ensuring that patient safety and well-being remain the top priorities while fostering a supportive and collaborative team environment.
What are some important considerations for safe and effective discharge planning from the PACU?
Safe and effective discharge planning from the post-anesthesia care unit, PACU, is a critical process that ensures patients are stable and prepared to continue their recovery in a less intensive setting, whether it's a hospital room, outpatient facility, or home. Several important considerations guide this process. Patient stability. The primary criterion for discharge from the PACU is the patient's stability. This includes normal vital signs such as heart rate, blood pressure, respiratory rate, and oxygen saturation. The patient should also have a patent airway and adequate respiratory function, with no signs of respiratory distress or significant fluctuations in vital signs. Level of consciousness. Patients must be fully awake, oriented, and able to maintain their own airway without assistance. Their level of consciousness should return to their baseline pre-surgery, and they should be able to follow simple commands. Any residual effects of anesthesia, such as confusion or excessive sedation, need to be resolved before discharge. Pain management. Effective pain control is another essential consideration. The patient should have their pain well managed with oral or intravenous medications, and they should demonstrate the ability to tolerate discomfort at an acceptable level. Additionally, any pain management plan for after discharge should be clearly communicated to the patient and caregivers. Nausea and vomiting. Postoperative nausea and vomiting, PONV, need to be under control before discharge. Patients should be able to tolerate oral fluids without significant nausea or vomiting. If antiemetics are required, they should be effective in controlling symptoms. Mobility and function. The patient should demonstrate adequate mobility for their condition, whether it's walking or simply sitting up in bed, depending on the surgery type. For outpatient discharges, the patient must be able to ambulate with minimal assistance and use the restroom independently. Wound care and dressing, the surgical site must be checked for excessive bleeding or other complications. The dressing should be intact, and the patient or caregiver must be educated on wound care, including signs of infection to watch for. Discharge instructions, clear, comprehensive discharge instructions are crucial. These should cover medication regimens, activity restrictions, follow-up appointments, wound care, and when to seek medical attention. Instructions should be provided both verbally and in writing, ensuring the patient and caregivers understand them fully. Transportation and support. For outpatient procedures, it's important to confirm that the patient has safe transportation home and a responsible adult to stay with them for at least the first 24 hours, as residual effects of anesthesia can impair judgment and reaction times. Communication with care team. Proper handoff communication to the next phase of care, whether to the inpatient unit or to the patient's primary care provider, ensures continuity of care. All relevant information, including medications administered, any intraoperative or postoperative complications, and specific care instructions, must be relayed accurately. By addressing these considerations, discharge planning from the PACU can ensure that patients transition safely and smoothly to the next stage of their recovery, minimizing the risk of complications and enhancing overall patient outcomes.